The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul. And today I have Dr. Jarrett Chapman of Living Well joining us. Dr. Chapman, thank you so much for being with us today.
Oh, thank you for having me, Shay.
And as we are approaching these colder winter months, holiday season, we're going to be, people are going to be out and about being seen. What
Mhm.
would you suggest? We're going to talk about what you would recommend maybe doing now to give yourself time to be ready for those events.
So basically, what I wanted to share today was energy-based devices, and how it's now the time to do those things. We've moved into late fall, getting ready to go into winter. So we have the time to have, quote, the downtime out of the sun, for our skin to repair itself. And, most of us are inside more at this time of the year. So one of the
Absolutely.
things, we want to talk about first is why energy-based devices, because they create what's called microthermal damage in the dermis. And the dermis is what we really want to target for fine lines, wrinkles, sagging of the skin. And unless you want to undergo a facelift, then energy-based devices are one of the best things you can do to actually tighten the skin. How this works is, let's say for microneedling, for instance, the small little tiny needles extend into the dermal region or into the upper epidermis, depending on which device you're using. And you get an overall stimulation of those fibroblasts, especially in the dermis, to really start producing more collagen, elastin, hyaluronic acid. And as if the audience will recall, those are the building blocks of youthful skin, and they allow us to get a nice snap back to the tissue. So here at Living Well, we have Profound Matrix, which is a phenomenal treatment that actually lets us adjust the depth of the microneedling. It gives us three different energies that we're allowed to use throughout the tissue. So we can really target where the energy needs to go specifically, without creating a lot of downtime. So the patient leaves, they're usually nice and pink. They might have a little tenderness to their skin, feel like maybe a little mild sunburn. Within 12 hours, that usually has faded and passed, and the patient's allowed to apply makeup and then move on. So they need about 12 hours of downtime. Our deeper profound, which has been with us since the probably 2015, I think we started doing profound here at Living Well. That's a little deeper stimulation, goes deeper into the dermis, gives a more intense thermal damage to that area. Really great for the sagging of the neck, the jawline. Does a fabulous job. Gives you about 40%, up to 40% of what a facelift would give you in the sense of retraction of the tissue. Remember, all these things rely on your body's ability to heal itself and
Sure.
for the immune system to actually stimulate the fibroblasts and get them to work. So, you know, patients in their 40s to 60s are going to see the best results from these devices. When you get above 70, I caution because, our immune system does slow down the older we get. Our ability to repair tissues slows down, and you may not see as big of a benefit above that. Doesn't mean you won't see some, it just you may not see the full benefit that you would from your 40s to 60s. But again, microthermal damage stimulates the tissue and the fibroblasts in the dermis, creates this beautiful snap back to the tissue. And so patients who are like, yeah, I don't want filler, or I'm not ready for filler yet, or, this is a definitely a way to go with minimal downtime. Usually takes about 3 treatments. So those are the cruxes of the things people usually want to know. They're done 1 month apart. Again, about 12 hours of downtime, if any.
Okay, well, good to know. And like you said earlier, now's the time to get it done, right?
Absolutely. Now is the time.
All right. Thank you so much for being with us, Dr. Chapman.
Thank you for having me.